Hello everyone, in this video I'll be explaining on the topic of bacteria, Staphylococci, Streptococci and pneumococci. Coming first to the Staphylococci, the morphology they are gram-positive cocci in clusters. They are non-motile, non-sporing, non-capsulated. Coming to the classification, they are broadly classified into two types, pathogenic and non-pathogenic. Pathogenic includes the Staphylococcus aureus. Non-pathogenic includes the Staphylococcus epidermidis and Staphylococcus saprophyticus. Coming to the mode of transmission, Staphylococci are most often transmitted by direct or indirect contact with a person who has a discharging wound or clinical infection of the respiratory or urinary tract or who is colonized with the organism in the body. The mode of prevention or method of prevention here. Following are the steps to avoid a staph infection and prevent it from spreading, which are keeping your hand clean by washing them thoroughly with soap and water or use of an alcohol-based hand sanitizer. Second, keep cuts and scrapes clean and covered with bandages until they heal. Next, avoid contact with other people's wounds or bandages. And do not share personal items such as towel, clothing, or cosmetics. Next, coming to the streptococci, the morphology are they are gram-positive cocci in chain. They are non-motile, non-sporing, non-capsulated. And the classification, they are broadly classified into two types, obligate anaerobes, which includes peptostreptococci, and next is aerobes and facultative anaerobes, and then which are again classified based on hemolysis and into alpha hemolytic streptococci, which includes Streptococcus pneumonia and Streptococcus viridans. Next, beta hemolysis, which are Streptococcus pyogenes and Streptococcus agalactiae. Next, gamma hemolytic, which are Enterococcus. Coming to the mode of transmission, it is usually transmitted via large respiratory droplets or direct contact with infected people or carriers. It is usually transmitted by direct contact through objects. These bacteria are spread by direct contact with nose and throat discharge of an infected individual or with infected skin lesion. The risk of spread is greatest when an individual is ill, such as when people have strep throat or an infected wound. Method of prevention, it can be prevented by hand washing is one of the best way to prevent the spread of common streptococcal infection. Skin infection can best be avoided by following hygienic measures and generally improving standard of living in tropical and subtropical countries. Next, coming to the pneumococci, they are gram-positive cocci, non-motile, non-sporing, non-capsulated, and where the cocci appear lens-shaped and typically arranged in pairs, diplococci, and they are capsulated. Coming to the mode of transmission, the streptococcal bacteria spread from person to person by direct contact with respiratory secretions like saliva or mucus. Many people, especially children, have the bacteria in their nose or throat at one time or other without being ill. Next is the method of prevention. It can be prevented by vaccination. Coming next to the collection and transport of samples for laboratory diagnosis or for the streptococcal, staphylococcal and pneumococcal infection. The specimens collected are collected based on the nature of the lesions of the patient. First, pus it is collected in case of suppurative lesion. Sputums are collected in the respiratory infection. Blood can be collected in case of septicemia. Urine sample can be collected in case of urinary tract infection. and CSF cerebrospinal fluid can be collected in case of meningitis. Feces or stool sample can be collected in case of food poisoning, and food or vomit can be collected in case of food poisoning. This specimen should be collected in sterile container under aseptic condition and transported in pipe transport medium.